Buoy Health Insights, Slow Heart Rate. Welcome to another episode of Buoy Health Insights. If you're experiencing a slow heart rate or bradycardia, this could be completely normal, particularly if you're young or physically fit, as your heart may be more efficient at pumping blood. However, there are cases where a slow heart rate indicates a medical issue that needs attention. Let's dive into the potential causes and what you should look out for. First, it's important to understand that a slow heart rate can be linked to a problem with the electrical system that makes your heart beat, known as a conduction system disease. This condition can lead to additional symptoms like lightheadedness, dizziness, weakness, and even loss of consciousness. As you get older, the wiring controlling your heartbeat may wear out, leading to a slower heart rate, or in severe cases, interruption of the signal that prompts your heart to beat. If you notice these symptoms significantly impacting your life, you should see your doctor as soon as possible. A heart that doesn't receive enough oxygen can also exhibit a slow heart rate. If you ever suspect you're having a heart attack, characterized by symptoms such as chest pain or tightness, swollen limbs, dizziness, confusion, shortness of breath, fever, chills, and loss of consciousness, you need to call 911 or go to the ER immediately. Treatment for a heart attack can vary, but may include medications, stents, or surgery. And in some cases, to maintain a proper heart rate, a pacemaker might be required. Other conditions that may cause bradycardia include obstructive sleep apnea, which is a disorder that affects your breathing during sleep. Symptoms not only include a slow heart rate, but also excessive daytime fatigue, snoring, the need for frequent naps, and lightheadedness. Obstructive sleep apnea typically occurs due to an obstruction caused by excessive soft tissue in the mouth, especially common in overweight and obese individuals. Treatment involves using an airway pressure device as you sleep to ensure sufficient airflow into your lungs. Additionally, heart infections such as myocarditis and endocarditis, caused by viral, bacterial, parasitic, or fungal infections, can affect your heart rate by damaging the heart's electrical wiring. These infections can be accompanied by fatigue, chest pain, shortness of breath, leg swelling, fevers, nausea, and possibly a previous illness. Treatment focuses on the underlying cause, but again, a pacemaker may be necessary to maintain a regular heart rate. Sometimes having a slow heartbeat is healthy. For example, distance athletes or those who are very fit will commonly have a slow heart rate. This is because their heart has become extremely efficient in pumping blood to the body. This is not a concern unless there are associated symptoms of dizziness, weakness, or lightheadedness. Finally, some medications can cause the heart to beat more slowly. Beta blockers are a common medication used to treat high blood pressure and have the potential to slow down the heart rate significantly. So when should you seek medical care? You should keep an eye on other symptoms accompanying your slow heart rate, as these can indicate the severity of your situation. For example, symptoms like heart palpitations and reduced energy levels suggest you should call your doctor. However, if you experience more severe symptoms, like those associated with a heart attack, you should get to the ER promptly. Remember, while a slow heart rate can signal a heart issue, it's not an absolute indicator. Athletes and younger adults often have naturally slower heart rates due to a more efficient heart muscle, but it's critical to differentiate between this natural occurrence and potential health problems. If you're monitoring your situation at home, pay attention to what's normal for your heart rate, stay hydrated, exercise regularly, and enjoy a diet rich in leafy greens and less meat. Before we close up, if you found this information helpful, please give us a like and subscribe for more health insights. Stay vigilant with your health and don't hesitate to reach out to a healthcare professional if you have concerns about your heart rate. Stay healthy and see you next time on Buoy Health Insights.